你在路里啊，在经常领养啊，可是像你都没好了啊，像给你上班没好，还是要让那个想。
They had a trip planned in 2005, and the orthopedic doctor that was going to lead the trip got sick or had some problem, and they reached out and asked me, and I was intrigued to buy it. So I went in 2005 to Shanghai and then have been invited back several times since then. I think the most amazing thing is that what a different country it is, and you know, how many people there are there. They have a pretty sophisticated healthcare system, and they do some things pretty well, but they don't take care of the poorer population very well. It was really sort of eye-opening and life-changing. Mostly hips and knee procedures. We did some, the first time I went to Shanghai, we did some difficult fracture cases and sort of post-traumatic fracture cases, but through the years it's evolved into sort of helping them with complex hip and knee reconstructive procedures, hip and knee replacements. One patient that we operated on a couple of years ago was a young woman who had bilateral hip disease from birth, had several failed surgical procedures as a child, and really had no motion in either hip, and was a minimal ambulator, could hardly walk. And we operated on her about 3 or 4 years ago with the Chinese people, did bilateral hip replacements. And it's pretty stressful because we don't have the backup equipment that we have available here, and you really have to get it right. And it was a pretty taxing procedure for all of us, but in the end we were happy how it turned out, and we've been able to see her and follow her the next 2 times we've been and see how well she's done. It's kind of fun to put together a team from Portland that then goes together and functions as a team elsewhere. So there's a lot of sort of team bonding that goes on through that whole process. It's not quite as exciting as being in the hockey locker room, but it's pretty fun to put together a team of other doctors and nurses and techs and really get to know them and work closely together with them in a stressful environment. So there's that aspect of it, and then there's the sort of rewarding feeling that, you know, you see these patients who otherwise wouldn't get this kind of medical care because of financial reasons, and we're able to help the Chinese provide that. And then there's the aspect of sort of working together with the Chinese for us to learn from them and from them to learn from us, and see how their approach to healthcare and their approach to orthopedics and surgical intervention sort of has evolved through these trips, and to see the growth there is sort of rewarding as well.